And welcome back. Well, nitrous oxide, aka laughing gas, is widely used around the world for pain relief during birth. 60% of women in the UK and nearly half of the women in Australia and Canada rely on it.
So what's wrong with the United States of America?
So behind.
Laughing gas is gaining in popularity here, though, too. And our next guest recently announced they are the first healthcare provider in Southeastern Wisconsin to offer nitrous oxide for labor and delivery. So joining us now from Moreland OB-GYN and Associates is Dr. Debra Olson and Dr. Stephanie Voice. Great to see you both.
Thanks for being here.
Thanks for having us.
I was surprised when I heard about this. I've never actually had laughing gas. Tiffany loves it. She wants a canister in her house.
I'd go to the dentist every day for it. Root canals, whatever.
Now I think she might have kids because of this here in Wisconsin. But what's the deal with it? Why are you fans of it? What took us so long here in the U.S.?
Well, it's an awesome option for patients. It allows them to move around. It allows them to have control over it, which is really important for women. They put it on, they take it off, they decide when they use it. Allows them to push effectively. It hasn't been used in America because we didn't actually have a machine that was available and that was FDA approved until 2012. So that's the reason. And now that it's been approved, women are getting on board, women are excited about using it, and we're excited to offer it to them.
So what's the difference between, you know, because like I joke, I've had it obviously at the dentist. So what's the difference between nitrous at a dental office and what you'd use there? Why are the machines different?
So the nitrous that you use at a dentist office is a higher concentration than what we use on labor and delivery. They also, in the dentist office, tend to put it on you and it straps on you.
Right.
So you don't necessarily have the control of when you're using it and not using it. In the labor and delivery room, it's a lower concentration, so you're not maybe feeling as out-of-body experience as you might in the dentist office. And then you hold the mask on yourself and you can breathe it just during your contraction, take it off when you're done having your contraction, and you kind of go back to being your normal self.
Oh, this I like.
And this is something you don't know, Molly, because you haven't done it, but the moment you take it away, it's gone. Yeah. You have no effects. You don't feel it anymore.
Oh, okay. Because what I wondered, and that's good to know.
There's no grogginess. You're not feeling anything.
Because I think of people in the dental chair more being kind of loopy and kind of out of it. And I would just think in labor and delivery, you'd want to be a little more with it to be able to hear the instructions, to be very aware of what's going on. But it sounds like that's possible.
Yeah, yeah, that's the kind of the great thing about the way that we're using it is helps you during that contraction with anxiety and pain, and in between you can have normal conversations, move around, you know, still really enjoy your labor.
Is it in place of an epidural?
Not necessarily. So some women use it to get to the epidural. They use it at the beginning, and then when things get a little bit tougher, they can always get an epidural. That's not a problem.
Okay.
Some women choose to try to do naturally and want to go without that epidural. They want to be moving around and active, and so this is a great option for them.
When we were looking at that list of benefits that we put up at the very bottom, it says a few risk factors. So I wonder, what are the risks? Are there any risks known to you or to the baby?
So there are no risks known to baby, which is wonderful.
Great.
And we've been, like I said, it's been used for decades across the seas. And risks for mom are really pretty minimal. Most people, if they're going to complain of anything, would be a little nausea, maybe vomiting, about 15% of people. And then you can feel a little bit dizzy, which is why, you know, you can take it off in between.
That's why it's so good.
Back to
Let's talk about the benefits then. Right, weigh the pluses and the minuses. The benefits of it for labor and delivery seem quite lengthy, which is great. We have a graphic that kind of goes through all of these things. It's a very unique pain relief option, it seems like, and one that you can control, which is nice, but used effectively for pain, anxiety, to promote relaxation. Also fast acting. Right? Yeah. And you're in control of it. You can get up and move around, which you certainly can't do with an epidural. In fact, you can't get up for quite a while, in my case anyway, until it wears off. So between contractions, you can remove it, and you have no effects from it. It wears off quickly, as Tiff mentioned. Few risk factors we mentioned, but you really you're already using it, right, and offering it as an option.
You used it for your own delivery, right?
I did. So I actually delivered back in Michigan, where I trained, and we had it there, and I loved it during my delivery. I knew in the long run I wanted an epidural, but up to that point I wanted something where I could be in control, kind of feel like myself. Sometimes we offer people IV pain medicine too, but that kind of makes you groggy and sleepy for normally a couple of hours, and I didn't want that. So this was great because it gave me a sense of control. When I felt my contraction coming on, started breathing it. When that contraction was wearing off, stopped breathing it, went back to my normal self. I could bounce on my little labor ball. I could move around the room. So yeah, I really loved it.
Yeah, it's okay for patients to ask about it, would you say, to their doctors if it's not currently an option?
Yeah,
Yeah,
absolutely.
And people can find out more too.
And quickly the cost, because I know at a dental office it's just, you know, kind of a flat add-on fee. How does it work in terms of labor?
We're very lucky at our institution. ProHealth has decided to just add it as part of the normal cost.
Oh, wow.
So if someone chooses to do it, they don't have to worry about
just
extra
there.
bills. It's
Wow.
just there. So we're very appreciative.
Very nice.
Can you come in and try it ahead of time?
All right,
They
great.
haven't let us do it.
I know, I'm totally teasing.
The experts at Moreland OB-GYN have created resources to help you understand your options for pain relief during labor and delivery. You can learn more about nitrous oxide and access the free resources by going to this website. It's morelandobgyn.com/health, again, to find out more.
Cool stuff, you
Great
guys.
to see you.
Thanks for being
Thank
here.
you so much
for having us. We
Yeah.
appreciate it.